All right. Hello, everybody. Welcome in. We're going to get started in just a couple of seconds. Give everyone some time to file in here. It looks like we're going to have a pretty big crowd, so really exciting. Thanks for being with us. While we're waiting, if you guys want to throw in the chat where you're joining us today, that would be super exciting. Just a heads up on the chat, it's going to default to just send to panelists. So send to everybody if you're able to do that. We can get to know each other a little bit. And like I said, we'll get started in just a second. All right, awesome. It looks like we got people all over the place today. So this is super exciting. If you're joining us from another time zone, thanks for being on time. It looks like we're slowing down a little bit, so we'll go ahead and get started. My name is Katie. Like I said, thanks everybody for being here today. We've got some really exciting things to share with you about our school that we all love. We've got a great panelist of a bunch of students. We're going to talk about a whole bunch of student orgs. Please leave your questions until the end. We will do a Q&A session at the end. We're just going to use the chat function as the Q&A, but I'm going to be reading those. So if you could hang out until the end, get to know all of our great panelists, and then I'll announce the Q&A. You can throw your questions in the chat. Like I said, feel free to share it with everybody, just so everyone can see what questions we got going on. We're super excited for you guys to join us today, and I'm going to go ahead and get started. And then I'll pass it off to my great panelists here as well. So my name is Katie. I'm originally from San Diego, California. I went to UCSD. I graduated in 2022, and then I came straight to Wayne. I'm involved in a whole lot of stuff at Wayne. I love Wayne. I chose it explicitly for all of the opportunities that we are given, even starting the first week of M1. So today I'm going to be talking about some of the clubs that I'm involved in. Just as a brief overview, I'm the events manager for the MD ambassadors. So I'm an MD ambassador, which does like tours, and we do the coffee talks, which you guys might know. We also put on events like this. So that's a great opportunity. You're going to get to know a lot of our ambassadors over the next couple of months as you prepare to start medical school. So that's a huge part of what I do here. I'm also going to be talking about first aid. So I'm the president of First Aid First. And we're an organization that's a little bit unique as compared to some of the other organizations because we're basically run just by the board. And what the board does is go out to the community and teach hands-only CPR. We do stop the bleed. We do a lot of first aid techniques. And we teach school bus drivers and churches, and we'll go to nursing homes, and we do all sorts of stuff like that. So it's really exciting. Life-saving skills that are super easy to pick up and to actually make a difference. So I'm really passionate about that. This past year, actually, our board implemented a new exciting challenge. My t-shirt, we did a university CPR challenge. It was called Stop a Bleed, Start a Heart. And it was a new challenge where we challenged other medical schools. We got 4 or 5 different medical schools in Michigan to compete with us throughout the entire month of September. And we went out and just set up pop-up tables, and we trained as many people as we could in, like I said, CPR, and then also stop the bleed. So together over the month of September, we trained over 600 civilians in these skills, which is extremely exciting. And it's also exciting for you guys because this challenge opened up a lot of opportunity for our peers and our other students to get involved without being on the board. So if you're looking to come to Wayne next year, that's something that we're going to continue doing, and it opens up the opportunity for people to get involved directly with their community in not only a teaching and mentoring way, but also in like a clinical based way that's actually like proving to make a difference at every time that we train somebody. So that's super exciting. Outside of first aid, I'm also on the board of art and medicine, which is sort of just a hobby group. So not everything that we do here is super serious and super medical based. Obviously, that's a big part of our lives, but there's also lots of hobby groups. So I love to paint. I'm in the art and medicine club. There's lots of music clubs and people that play sports together and all sorts of stuff. So I'm sure you'll get to hear more about that from our other panelists as well. But there are things to do to to keep your livelihood and to keep your hobbies going as well, which is really exciting. And then my last two quick things, and then I'll stop talking. I'm also a member of what's called EMIG, which is the Emergency Medicine Interest Group. So think of any specialty that you might possibly be interested in. I'm sure that we have an interest group for it. The interest groups basically run different events. So they'll do like a skills night, or they'll do, a panelist night, and they'll have residents come or doctors come, and they're able to connect you with people to shadow and skills and things like that can help tailor you to different specialties that you might not even be aware of and might get to explore, which is really exciting. So for me, I like emergency medicine, so I'm involved with them. And you don't have to be, involved in all of these different clubs. You can kind of just pick and choose what you want to go to. Everybody gets invited to these things. So really good way to build community and get exposed to things that you might not have anticipated seeing beforehand. And then lastly, one of the other small groups I do is called Phone Pals. And it's just a community-based organization where we get paired with senior citizens who don't have family or people to check in on them, and then you call them once a week and you check in, you see how they're doing, and it's a good way to build rapport and be involved in the community. So those are just some of the humble things that I do. There's a million more opportunities. I'm going to pass it off next to my good friend Zoha, and she's going to share some slides with you and go over the things that she's involved with.
Hey everyone, my name is Zoha. Thank you, Katie, for that great introduction. So I am an M4, so almost done, which is kind of crazy to think about. Like I was in your shoes not even that long ago. But I'm originally from Canton, Michigan. I went to the University of Michigan for undergrad, graduated in 2019. And now I'm here applying med peds for residency. So that's what's kept most of my time. But today I'm going to talk about an org that is really dear to my heart called Escalaphons. I'm going to share some slides real quick. Everyone can see my screen. Cool. All right, I'm just gonna share it. Yeah, so one of the big reasons I chose Wayne is because of its dedication to community service, and Escalaphons Honor Society is probably like one of the really like important ways you can give participate in the community through service. So who we are, we're an honorary service org devoted to the city of Detroit, as well as Wayne State School of Medicine. And we select students every year from all four classes, or I guess all three, like the M1s, M2s, and M3s, who have showed like a dedication to community service and participation in extracurriculars. So those who are dedicated to serving the Detroit community, every year we select a handful, and those who are selected get to take part in what we do. So if you want to take a second, scan this QR code. I have quite a few of these in these quick slides to see what our website looks like right now. But you could just listen on ahead as well. So our big thing is community service. One big thing we do is we partner with one Detroit-based nonprofit organization that we call our Community Partner of the Year. Our years start like in April, and then we spend like a full calendar year working with our CPOTY for the year. So we spend the summer reaching out to different organizations that our members actually nominate, and then we send them like a quick application of who we're looking for a CPOTY. And then by the end of the summer, we have a good like 3 to 5 groups that we end up deciding and voting on as a collective to choose as our CPOTY. And then throughout the year, we work with them to serve whatever their needs are. We create programming. So like as medical students, a lot of orgs love to hear our takes on different health conditions. So we've hosted like community health fairs and like other like blood pressure screenings and things that, medical students are equipped to talk about. But then we also just serve wherever they like want us, because we have 60 really interested people who have like the ability to give back. So we allow the CPOTY to tell us like where our help is needed. So below we have some pictures with on the left is our CPOTY this year, which I'll talk about in a second, Live Outreach. And this was I think it was like a housing project that they worked on. And then on our right is Congress of Communities, where this was our community partner last year, and it was an event that they did like just being out in the community and just doing great work with like the members that they serve. So just a little bit about the kinds of orgs we work with. So we have a really big variety of orgs. This year, we've partnered with Live Outreach, whose mission is to help develop like skills and support for youth within the foster care community. So I'm really excited to work with them this year. We've just started working with them like this past month. So it's been really great so far. And then on the right, you can see like the types of orgs we worked with in the past. So last year was Congress of Communities, which is an org based in Southwest Detroit that empowered the youth to, be advocates in the community and build like life skills trainings and career development. Brilliant Detroit worked on education for K through 12, like enhancing reading ability. We even have like Michigan Urban Farming Initiative. That was a group that worked on an urban farm here in Detroit and like worked a lot to like supply produce for the city. So it's been a lot of cool, very interesting things. So aside from working within the community, we also fundraise for our local CPOTY. We try to raise at least $10,000 throughout the year with various fundraising initiatives. Last year, we raised over $14,000 for Congress of Communities, and we do a lot of different things to raise this money, like apparel sales. Individual members reach out to people they know, or we do like things on like Instagram, like on Giving Tuesday. But then our biggest fundraising event is Lampoon. So last slide here, Lampoon is our annual comedy sketch show. This is a show that we host once a year that basically makes fun of life in medical school, especially life at Wayne State School of Medicine. It's something that's been going on for like the past 50 years, and it's something that Wayne alumni still really talk really fondly about. If you want to scan this QR code here, we have it goes to a YouTube playlist of like the skits from last year's show. And we basically like we make fun of the school, we have a good time. Even the faculty, like we've had deans be involved in skits before, professors that you will work with if you come to school here, like they've been in these skits as well. And it's just a fun night for everybody. And like this year's theme is Up and Wayne, so it's like a little more superheroes, I guess. But last year, the one in the QR code, the theme was Wayne Flicks. So we did like parodies of different Netflix shows, and not even just Netflix, like just TV shows in general. Like one of them was Wayne of Thrones, which was Game of Thrones, but like Wayne focused. So it's been like a lot of cool, funny things, and generates a lot of like interest within the student body, like a night for us to just, have fun and make fun of each other. So that's all I have to share about Escalapians.
Awesome. Thank you so much, Zoha. I hope everybody really enjoyed that. It's a great organization. Next, I'm going to hand it off to Curtis.
Hi, everyone. My name is Curtis. I am an M2, born and raised in Detroit. Went to undergrad at Grand Valley State University, all the way across the state of Michigan. I'm a Black Medical Association president, along with my great colleague, Julian, who's the SNMA president. And I'm excited to tell you about the Black Medical Association at Wayne State School of Medicine. So BMA is one of the oldest, if not the oldest, student organization in the school. We have a large presence in the school and local community by starting various community partnerships such as Wayne Mobile Health Clinic and after school mentorship programs with Rack It Up Detroit, and a very well-known program, Reach Out to the Youth. We also push Black medical student advocacy even beyond academic success, but also mental health and financial support as well. Our wonderful vice president started culturally affirming peer support. That's about once or twice a month. We have a long-standing fundraising opportunities that the whole school enjoys, such as our boat cruise that we hold every year, and even events that allow us to personally connect with physicians of our specialty interests. We have close relationships with Black faculty and physicians for any support that we may need, such as step one support or any help that we may need, which is an amazing opportunity to have. The BMA is a sense of home, comfort, and support for all Black students in their medical journey. I'm also part of Street Medicine Detroit. You'll hear about that later on. Our school's Institutional Justice and Inclusion Committee and ENT interest group. So I'm here to answer any questions you may have, and I could put my email in the chat if you have any questions.
Thank you, Curtis. Next up with a similar organization is going to be Julian.
Good afternoon, everybody. I'm the co-president with Curtis. So the Black Medical Association is the local affiliate of a national organization called the Student National Medical Association. That's SNMA. SNMA was born out of the exclusion of Black people from medicine. If you may be familiar with the American Medical Association, at one point they didn't allow Black people to join. So the National Medical Association was created. And from the National Medical Association's birth in the 1890s, they created a student version, which is SNMA. There's 165 chapters across the United States, and Wayne State just happens to be one of them. We're called BMA. And we're part of Region 5, which is Michigan, Indiana, and Ohio. And a great thing that we have with SNMA is we have 4 conferences every year. One of them is AMEC, which is the annual medical education conference, where people of Black descendants and African descendants meet up in one place. Next year is going to be in New Orleans, and they present their research, learn clinical skills. Like last year, I learned intubation. And other than that, Curtis covered pretty much everything else BMA does. We have a large outreach effort. And other than BMA, I just founded the Aerospace Medicine Interest Group. So aerospace medicine deals with every aspect of medicine applied to space flight. And as you know, with Jeff Bezos taking a flight to space this year, there will be more opportunities for civilians to go to space, as well as NASA's efforts to get people living on Mars by 2040. So we'll need more aerospace medicine doctors in the future, and I want to be a part of that. So I created this group, and we actually have an astronaut coming to talk to us on Tuesday, and we'll be bringing more astronauts and flight surgeons to the School of Medicine. We actually had an astronaut graduate from Wayne State in the 90s. His name was Jerry Laniger, and he went to the International Space Station. So Wayne State has a large history of sending people to NASA and space. So if anybody's interested in aerospace medicine or the Black Medical Association, let me know.
Thank you so much, Julian. Yeah, we've got some really exciting stuff going on here at Wayne, so I hope you guys are getting excited. Next, we have Gabby.
Hello, my name's Gabby. I'm an M2. I grew up in Florida. I went to University of Florida for my undergraduate. So I'm the vice president of the plant-based nutrition group here at Wayne, and I'm going to tell you a little bit about what we do. So our main mission is to educate ourselves, our peers, and our community on the benefits of plant-based nutrition, as well as how to use it as a tool in the future as future physicians. So a lot of what we do is obviously working in the community at local health fairs to bring this plant-based nutrition education firsthand to members in our community. But of course, we have events at the school where we bring in local plant-based experts, both from the medical fields and non-medical, to kind of lecture us on the benefits of plant-based nutrition and ways we can use it as a tool in the future to help our patients. So our largest event we do every year is called Plant Plunge. It's about a month long, and we partner with a local nonprofit called Chickpea and Bean. And they're also really passionate about plant-based education and nutrition. And so we bring in, like I was saying, local experts from the community, both docs and non-medical. And they just kind of give us their insight. During this month, we also encourage students to implement a more plant-based diet into their lifestyle. And we help them out by providing recipes, and we often start them out with a little bit of food to get started. And we give students the opportunity to monitor their blood glucose and lipids over the month to kind of see firsthand the effects of a plant-based diet on cardiovascular risk factors. So I think that's a really unique experience. And I always like to give a little bit personal story because I was pre-diabetic for many years before starting my plant-based diet journey. Helped me get out of that pre-diabetic range. So I'm a big believer in it. And I think, it's really important to understand how to use it in the future to treat our patients, whether that may be, a supplemental therapy for diabetes, cardiovascular disease. And I want to emphasize this club is not about being vegan or about being vegetarian. Most of our members are not even, I like to say flexitarian. It's not about that. It's about really understanding how to use plant-based nutrition to benefit your own health and understanding how to implement it as a future physician. So if you guys have any questions, don't hesitate to reach out. I'm going to drop our Instagram in the chat so you can kind of keep up on what events we do if you guys are interested. But yeah, that's it. Thank you.
Thank you so much, Gabby. And lastly, but not least, we have Maria and Netta.
Hello, my name is Netta. I am a fourth year medical student here at Wayne State, and I'm also the president of Street Medicine Detroit. I'm from Michigan originally. I actually did my undergrad at Wayne State as well, so I've been local for a while now. And yeah, I'm really excited to talk about street medicine with my colleague here, Maria.
Hi, everyone. I'm Maria. I am an M2 at Wayne State. I'm the vice president of Street Medicine Detroit. I'm also involved with the American Medical Association and an external committee of our student senate. I got my undergrad in Ann Arbor at University of Michigan, and then I spent some time in Boston getting a master's, and now I'm here with all these wonderful people. So I'm going to share my screen to help guide us a little bit. Can you see that?
Yeah.
Okay.
Cool. So I'll get started real quick. I first want to just thank the organizers for giving us the opportunity to speak about street med. It's one of my favorite things to talk about. But it was founded 11 years ago by then med student, now attending physician, Dr. Johnny Wong, under the leadership of the late but ever inspiring nurse Dean Carpenter, as well as our current faculty advisor, Dr. Richard Bryce. And they just recognized that there was a need that needed to be filled within our community. So I'm really excited to hand it off to Maria so that she can delve further into how this need, or what this need was, and how they strove to address it.
So just to give a brief overview of our mission. So Street Medicine Detroit's mission is to ensure access to quality medical care for Detroit's unreached houseless population. We do this through direct and regular outreach, and we hope to bridge the gaps between the houseless and medical communities by building relationships and offering companionship and respect. Like Netta said, Street Medicine Detroit started 11 years ago with a vision, and we've been growing and evolving with the needs of our population to better address their health needs. So I'm not going to go into detail about these things, but these are the pillars with which we operate around. There are two main ways in which we provide care. So the first way is through what we call a street-based run. Basically, what happens is we pack up all of our medical supplies, any outreach supplies that we have. This includes like harm reduction kits, any food, clothing, things like that. All of our medical student volunteers, so that is a really cool opportunity here at Wayne. You could volunteer with us. Our physicians, any kind of housing coordinator, social workers, we pack them all up in a car and we drive around our community and we meet our folks where they are at the street, on the streets, and work with them to help them feel a little bit better. And then we also provide care in a more traditional medical sense. So we also put on these pop-up mobile clinics at shelters throughout the community and provide what we probably think of more traditionally as medical care. So glucose testing, blood pressure, things like that. What's unique about Street Medicine Detroit and our patient population is that the scope of inequities and challenges that our patients face is a lot more complex than lack of access to medical care. And these unique challenges and needs associated with the experience of houselessness is not met the second that we provide care on the streets. And this is why Street Medicine Detroit, we have a really large board with a lot of different roles. We try to include other multidisciplinary leaders in our the work that we do. This is why we invite housing coordinators and social workers to come out with us so that we can better address the psychological, social, and economic needs of our patients. And we do all of this with the patient at the center. Our main goal is to create meaningful connections with our patients and rebuild relationships and trust and center them in what we are doing. Our number one goal is to always meet our patients where they're at, work with them to do what they're comfortable with at the time, and accept them as is. And it's through this approach that we try to embody the fact that yes, medicine and health is really important, but we're also here to build relationships and make connections and rebuild broken trust. And so I'll pass it back off to Netta to talk a little bit about what we've done in the past year.
Thank you so much, Maria. Before we wrap up, this is our last slide, but I just wanted to spend some time giving you a glimpse into what we've been able to accomplish. As you can see here, just in 2022, we saw 305 patients. So that's 305 individuals who otherwise would not have had access to healthcare, which is, I think, I would say pretty remarkable. We've also been on 81 runs total. So Maria spent some time explaining the difference between the shelter and the street runs. So it's 27 street runs, 34 shelter runs. We've hosted over 150 volunteers, 167 to be exact. And in doing so, we've pulled over 150 community members into this very meaningful and impactful work that we engage in. Maria kind of alluded to this already, but a huge part of our mission is centered around rebuilding broken trust with our patients. And these are patients that have been the most alienated by the healthcare system. And the first step that we have to take before we can accomplish that goal is provider education. So by offering so many volunteer opportunities to people in the community, we're showing them how to properly engage with patients experiencing homelessness on the ground, face to face. It's truly just a life-changing experience. The last thing I'd like to mention is that street medicine has a presence that is recognized on the regional, national, and even international stage. We recently just hosted our very first regional conference, the Street Medicine of Michigan Symposium here in Detroit at Henry Ford. I'm actually sitting here at Henry Ford right now. We've also attended the International Street Medicine Symposium, both when it's held nationally, so within the US, as well as internationally. We just had a team of students represent us in London, UK last September. So in short, there's just really a lot to get involved in as a member of Street Medicine Detroit. And I really hope that all of you listening on the call get a chance to experience it. Thank you so much.
All right, thank you guys so much. So that concludes the introduction of all of our panelists. So what we're gonna do now is move into our Q&A sessions. We have about half an hour. If you guys wanna put your questions in the chat, you can send them to just us or you can send it to everyone so we all know what's going on here. We're gonna all be spotlighted. If you guys have specific questions for one group or another, feel free to ask those. Otherwise, if you have generic questions, we can kind of bounce around and see who has the opportunity to answer that. We covered a lot of really great organizations. By no means is this everything that Wayne has to offer. So if there is something, that wasn't touched on today that you have a question about, feel free to ask it. We will try our best. But there will be more opportunities in the future as well to ask these questions and get to know us as well. So yeah, with that, we will hang out here for a second and get some questions going. All right, it looks like some of our first questions are going to be related to street med school. Go ahead and hand those off. So firstly, I see, is there a collaboration between mental health and providers for street medicine?
So that's a great question. Annetta can pop in if she has anything else to add. This is something that we're currently working on, is bringing mental health providers with us out on runs. It's hard getting physicians to volunteer their time and also be educated in the way that street med works can be somewhat of a challenge because they're also incredibly busy, but this is a huge need of our population and a top priority for us. I don't know if Netta, you have anything else to add?
Yeah, for sure. I like Maria said, it's definitely something that we've worked on. I think one challenge that as an organization that we experience because of the population that we're dealing with is consistent follow-up. And so something that we learn in medical school is, with psychiatric medications or things that have to do with mental health in general, even without medications, that would require pretty consistent follow-up, and that's a challenge that we face. We often have a hard time making sure that we're seeing our patients as consistently as we would like. So we're working on, it's actually something that our organization is working on currently. We're really trying to really reinforce our follow-up system so that we can start to offer those needs. But that's a fantastic question. Thank you for asking.
Yeah, thank you guys. The next question I see on here is about the ambassadors program. So I can go ahead and take this really fast. So our ambassadors program is pretty widespread. It's unique in the sense that there's an opportunity for students to get involved even if you're not on the leadership team. So like I mentioned previously, I'm a general ambassador, and then I also happen to be on the leadership team. So I do a little bit of the behind the scenes work with setting up events like this, moderating them and things like that. But the ambassador program itself is really, really great. We do a lot of stuff working forward with you guys. So we'll do, like I mentioned, the coffee chats, and we'll do like the student Q&As. Once students start to get interviewed, we'll do tours on campus and things. But we're also really big in the presence for the M1 orientation. So if you guys are to come to Wayne, we'll be doing your orientation tours, and we'll be showing you around. And we do, in that sense, it's sort of a mentorship program. So we have the opportunity to kind of work with our students and share our perspectives and things like that. So it's really great. And we're always looking to expand it and come up with new ideas on like how to reach not only you guys and incoming students, but also our peers as well. So hopefully that answered your question. I love doing this kind of stuff. I love Wayne, so I love sharing my passion for Wayne, which is really what the ambassador program is about. So the next question that I see on here is about any religious organizations, specifically Jewish. I don't know if anyone has something specific that they want to share about that. I do know that we have some religious interest group type organizations. I don't know anything specific. Does anyone have a better answer for that?
Yeah, we do have like quite a few religious and cultural orgs on campus. So I think someone in the chat did say, yeah, there is a Jewish Medical Student Association. There's also the Islamic Medical Student Association that me and Netta were a part of. And then there's a Christian Medical Student Association as well. And then there's I mentioned some of the cultural student organizations as well, like ethnically based, that include like the Asian Pacific American, South Asian Student Association, National Arab American Student Association. I think there's a Chaldean Association as well. There's like, you name it, we have it essentially. So yeah, there's a lot of diversity here at the school, and there's a place for everybody.
Awesome. Thanks so much, Soha. I'm going to combine a couple of these questions here. It looks like there's a couple of questions about like, how do you get involved with orgs? How much time commitment is it? And then like, given Wayne's large class size of, roughly 300 people, do the student orgs, are there enough spots for everybody? Do you get to know people really well? That sort of vibe. So I'll pass that off. Maybe we can get a couple of us to speak on that.
I can jump in. So from my experience getting involved in student orgs, student orgs have events throughout the year. There's all different kinds of things you can participate in, and there really are clubs for everyone. I do think it's a great way to get to know people who have like interests. So like for me, for example, joining the plant-based group, I was able to connect with a bunch of other students who also are really passionate about plant-based education. So it's definitely a great way to like meet some new people who may have similar interests, and there are plenty of groups for everyone. Don't feel the need to, there's plenty of groups. Find what you really are interested in. You're really going to love it. And there's a group for that, I promise. So.
Does anybody else want to add on to that?
I can just add a bit about time commitment. I think, I hope this answer is satisfactory, but really it'll depend. It'll depend on what org you're involved in and what role you have within that organization. And so I can just give you all an example of street medicine. Street medicine is unique in the sense that our board has upperclassmen roles. So like I mentioned at the beginning, I'm an M4. And I'm the president of street medicine. Oftentimes, you'll with the student orgs at Wayne State, you'll find that the president is an M2, depending on the structure of that board. And so although this is kind of a cop-out answer, it'll really depend. But the beautiful thing is when you're exploring the different organizations, there's usually full transparency, and you'll usually know who to contact to inquire about the role and what it'll entail and like the time commitment. And so I wouldn't be too worried about not being able to find a position that would fit into your interests and like the commitment that you're willing to make.
Absolutely. Thank you. And I'll just add on too, just to clarify, a lot of these organizations, we're all representing here today as leadership. So we're really involved in like planning and organizing things, but our events go out to everybody. So you're going to get dozens of emails with, hey, this person's doing this or this group's doing that. And so even if you maybe aren't willing to commit as a leader, or you're not really sure if that's something that you're interested in, you still have the opportunity to attend those events and kind of get to explore and stuff. So it really is great. Even if, I'm really focused on first aid, maybe I'm going to go hang out with the plant-based group and see what they're doing this week. And so it really is a good opportunity to kind of mingle and get to experience different things. So the next question I see here is for BMA, and it says, how do you feel that Wayne provides a safe space for Black medical students beyond academics? And if possible, can you give examples for that? So I'll pass that to Curtis. And Julian looks like he might have logged off. So hopefully he'll join us back again as well.
He went off to clinical skills right now, but yeah, I think Wayne is particularly our Office of Diversity and Inclusion. They have a keen understanding of some of the unique barriers that minority students go through. And so they kind of prophylactically help us so we don't have to like face those or be challenged by those, at least our medical education. One of the biggest things I'm grateful for is help for step one. And it's difficult exam, difficult to navigate, how to study for, different resources to use. So, the people out of our Office of Diversity and Inclusion, they're very helpful. And, if they don't have a particular answer to a question, even if it's dealing with connecting with another physician of a specialty interest, they know the people that they can get you in contact with. So I go to that office with any of my needs, and I find that they are really helpful. Yeah, that's one of the many ways that they help the Black students here on campus.
Thank you, Curtis. All right, let's see. We got all kinds of stuff coming in here, so I'm gonna try and see if we can hit as many as possible. So I see the question, are there any LGBT focused outreach groups? There definitely are. I don't know if anybody is involved in one on this panel, but we do have a pretty active LGBT persons in medicine group, and they do all sorts of events. They went to Pride this year, all sorts of stuff like that. So on that sort of a similar note, there's lots of questions about like, is there this, is there that? The answer is probably yes. There's also a question here about like, how can you start a new club and the leadership positions and stuff like that. I will just generically say, not something you need to worry about right now. The transition process comes slow. You'll usually transition in like towards, the end of M1, M2 and stuff like that. But even just in my time here at Wayne, I have like 3 or 4 friends that started new clubs. So it is absolutely possible. If there's something that we somehow have not managed to cover, it is super easy to get that started. So hopefully that answers that question. Let's see here. We got all kinds of stuff. Okay, so as a current Metro Detroit resident, is there an opportunity to get involved with street med without being a student? We'll start there.
So unfortunately, our volunteers are all medical students. I would say that if you want to engage with our team, we host pretty frequent educational seminars at some of the shelters that we volunteer at. So I think that'd be a great opportunity for you to come and attend and to meet some of the patients that we interact with, and then to interact with our team. But unfortunately, at this time, the volunteer spots are only open to medical students.
Yeah, thank you for that. And it's something to look forward to, as you get started to come to Wayne and things like that. The next question I see on here is about first aid. So I will take that. And then if people want to jump in, there are tons of stuff in here. So I'm trying my best to filter through everything. But so the question about first aid is, do we collaborate with public school systems in Wayne County and things like that? We do all sorts of stuff. So we have a website I linked in the chat earlier. People reach out to us. So I think this year we've done the Detroit Public school system will do like their PE teachers, their health teachers. We do the school bus drivers. We go to a lot of churches. We basically come to anybody who wants us. And then the thing that's unique about the CPR challenge is that that's kind of just a generic pop-up. So we were hanging out at the undergrad, we went down to Eastern Market, and that was really a new opportunity for us to kind of expand into some of our, you know, the community aspects that maybe we weren't able to reach before. So we do work directly with public health, as well as just kind of like generic for like whoever is able to reach us. And we offer those community trainings to whoever's there. Hopefully that helped. Okie doke. Sorry, I read so slow. I should not be in charge of this job. Okay, I see a couple of questions about Fit Kids 360, Detroit versus addiction. Would we be allowed to enter these groups? So, okay, I'm going to generically say that you have to usually be a student to start with this, but is anybody in those groups that want to speak a little bit about what those are on? Does anybody know? Okay, so Fit Kids 360 is like an exercise group that does, like, they'll be paired with families with obese children, and they'll go and like partner up and do like exercises together and stuff, which is really exciting. And then DVA or Detroit versus Addiction also does a lot of preventative care, and so they'll do like, you know, safe stick and things, and they'll go out into the community and provide education and do sort of a clinic-esque type experience. Is there a link to the Islamic Medical Education or Association? I'm sorry, can somebody put that in there? There's lots of cultural groups. We touched on that a little bit earlier.
I don't think the IMSA has a website, but they do have an Instagram page. I'm just not sure what it is. I don't know, Zoha, if you know this.
Yeah, I'm sure a quick Google search, you'll be able to find it. We also have the Get Involved page, has a lot of our stuff on there. Although that can get overwhelming because there's so many. Okay, I see a question for BMA, Street Med, and Escalaphons. Is there a regular yearly agenda that outlines each of the outreach organizations? This person is highly interested in sexual health outreach, HIV, that sort of stuff. So maybe if you guys want to go a little bit into kind of your yearly schedule, we can start there. We can start with Curtis for BMA.
Yeah, so there's no particular programmings that we have that talks about or at least actively teaching us about those particular subjects, but we do have speaker series, and this is more towards, you know, March area, where we cover many different topics from experts in that field, Black physicians who are experts in that field, such as Black maternal health, or HIV, or plastics, African-American plastic surgery, many different topics of interest, and it usually lasts about an hour, but you learn so much information. And it's even coming from physicians who practice in Detroit. So you also gain a rich history of some of those practices or events that happen in Detroit. So although we're not actively being taught how to care for those types of patients, we do get a dense history on it, and just get informed on current practices and stuff like that. Hope that answers your question.
Yeah, thank you, Curtis. Zoha or Maria, do you guys want to touch on your group's organization with HIV and sexual health related matters?
Yeah, so just generally, Street Med is out in the community about 2 to 3 times a week. So that's kind of a continuous rolling thing. We don't provide any specific HIV or sexual health services right now, but that's not to say that if we encountered a patient who was HIV positive or needed follow-up for care, that we wouldn't connect them with another clinic or someone else who could help more than we could. Something that Netta mentioned that we do offer to the community are patient education seminars. And so this would be one way that we would be able to provide like education on safe sex and HIV and things like this. And then I did want to mention that there is an HIV group on campus where they train medical students to go to clinics and do HIV testing and provide specific HIV counseling. I don't know if anyone here is involved in that, but that is something that there is an org here for that specifically. So I'll pass it to Zoha.
Yeah, so for Escalapians, what we do, really, like it depends on what our CPOTY of the year is interested in. And actually last year, so our community partner of the year was Congress of Communities, which is an organization based in like Southwest Detroit with a majority Latinx population. And one thing that we did was host community health nights that were focused on like women's like topics, including women's health and then sexual health for the youth and college age students. So we had like different workshops catered to different community needs. And I know that the women's health workshop was very interesting because we had like a primarily like older women community who like previously like these kinds of topics were not really discussed as openly and freely. So it was like our job to create a discussion and workshop that like was sensitive to their cultural concerns and needs. So like we've done like community health nights that are very like, you know, related to very sensitive topics before. I don't think in recent memory, I don't remember doing like a HIV specific one through Escalapians, but I know that if the need ever arises, we can do it. And also like our members are expected to volunteer throughout the community in various ways and like working in student run clinics and just other clinics in the communities, a way people do that too.
Thank you so much. I'm seeing a lot of questions in here for Julian. Unfortunately, he did have to step away for class. He did put his email in there as well. So if you have specific questions, I'm sure he'd be happy to answer those. Next, we're going to combine a couple of questions here. I'm seeing some things about the interest groups and the types of events that they might host. So I don't know if anybody is in, I'm sure we're all involved in one way or another, but if somebody wants to touch a little bit about like the interest group, just generically and like what sort of events that holds and how to get involved.
Yeah, so I'm in the ENT interest group. It's like for head and neck surgery. But generally interest groups provide, you know, speakers here and there for the entire school to kind of experience as well. And it's on various different topics, or they even provide upperclassmen who have applied to or matched into that specialty to talk about how we can kind of go towards that specialty as well. Interest groups are really catered to that specialty. Sometimes there are collaborations with that as well. But yeah, it's a great way to learn about different specialties and learning about the different things you need to do to try to match into that specialty. That's generally speaking.
Thank you. The next question I'll open up to a couple of our panelists here. I'm seeing lots of things about how being involved in a student org is contributing to your success as a student, how it might relate to, you know, your mental health and your wellness as a student as well. So I don't know if somebody, maybe we'll start with Gabby. You haven't had the opportunity to speak in a little bit. Just talking about like your experiences, like how do you balance that with all your schoolwork? Are things tailored around your schedule and that sort of thing? If you want to talk about that a little.
Sure. I think that that's something we all probably struggle with. I think with med school, it's just kind of thing where you could study all day, every day, and there would still be more stuff for you to learn, right? So at some point, you just kind of have to make the time for yourselves to do stuff that you're really passionate about. So that's why, you know, we recommend just getting involved with orgs that you really love. I myself am only involved in this one org, plant-based group, but that's just kind of what fits with my schedule right now. You know, I do feel like it has benefited me professionally just because I get the opportunity to go into the community as a medical student and interact with people in our community, the people that we, you know, that's our patient population, you know, so I think it's really important to have the opportunity as a student to interact with people and really share knowledge about what you're passionate about. And it's given me a little bit of, you know, excitement for the future. I'm really excited to use my plant-based knowledge that I've gained in this role as a future physician. So in those ways, I do feel as though It has helped with my professional development, but I don't think there's a right number of organizations to join. I think it's based on your personal schedule and your personal time management. So.
Yeah, thank you, Gabby. Does anybody else want to share their experience about how they balance things and how they feel that being in an org has helped them to grow as a professional?
Yeah, I can. The one thing that comes to mind for me is just the fact that Wayne State is such a big med school. It's like over 300 people. So joining orgs is a really great way to make a really big school a little bit smaller. And then also as far as professional development, I think it's really hard to recognize this as med students because we're so used to working so hard. And obviously med school is, it's challenging and it requires a lot of studying. But at the end of the day, like your career is going to, for the most part, center around like your patients and, clinical practice and, engaging with people. And so like, I feel like it's very important to make sure that you're still doing that, even in like the hustle and bustle of a studying busy med student. And so getting involved in orgs, it just kind of it like contextualizes all of the work that you're doing in those preclinical years, because it serves as this like consistent reminder of like what you're working towards.
Yeah, thank you so much. One of the next questions I see on here is about how we might implement concepts that we've learned during school with the orgs. And I'll start out on this and then we'll see if anybody else has some comments as well. But the way that I describe orgs or organize them in my own head is there's like the professional based ones and then there's the activity based ones. And so a lot of the orgs are focused on, like street medicine goes out into the community and first aid goes out into the community, and people go out and do, things that contribute to your medical education. So in those ways, you're putting your concepts to the test every single day. One thing that we didn't have the opportunity yet to talk about is the student run clinics, which is a huge appeal at Wayne. We have I think we have 10 or 12 student run clinics, and some are really big and some are a little bit smaller. But starting literally your first week of medical school, you can go out and volunteer in these clinics and you're seeing real patients and you're doing real physical exams and you're providing real care. And that can be super scary right at the beginning, but you'll get in with our classes. We've got clinical skills class and you'll learn these things in the curriculum, and then you'll literally turn around on Saturday and you'll put it to the use. So it is really exciting. It can be a very quick turnaround as far as rewards go for being like, oh my gosh, I just learned how to take a blood pressure and now here I am taking it, in the community at the Riverwalk or at the clinic or whatever. And so in a lot of ways you are practicing those things, or you'll see something in clinic and be like, man, I had no idea what that was. And then 2 weeks later, it shows up in your lecture. So it is really exciting. And it is a fast turnaround. And this is something that I think a lot of people, myself included, really enjoy about Wayne, is getting involved so quickly and being able to feel a little bit more like a doctor every day by getting out to go and do those things. So in a lot of ways, yes. In a lot of ways also, no, right? Like I mentioned, art and medicine, we don't really do a lot of clinical stuff. Maybe we'll paint things that look like histology slides, or we'll do something that's sort of related. But not everything is work all day, right? We do play a lot also. And so I saw some things like, oh, I like to play tennis, or, oh, I really like to, do music or whatever. A lot of the orgs are just social. A lot of them are to do fun things and to meet new people and stuff like that. So it is a really good balance. And a lot of people are involved in a little bit of both. That was a lot, but hopefully, does anyone else have something to add to that?
To address the tennis comment, someone in my class, we have a tennis group me for kids who want to play together, but it was just kind of someone in my class who made it and sent that out. So if that's something you're interested in, I think it's a great idea. It definitely brought a bunch of people in my class together, and they do go out on the weekends and play. So that's a great idea.
Yeah, there is tons of opportunities to do lots of things. So we have about 5 minutes left. I have personally scrolled through everything. I think we've hit a lot of stuff here. Thank you to the panelists to helping me respond as we went through. If there's any last minute questions, we have a couple more minutes that we can answer those. Just to fill a little bit of time, I did see a couple of questions about some research and whether or not the organizations provided any research opportunities. Does anybody want to speak on that? Otherwise, I can briefly.
I think Curtis may have put something in the chat. It's pretty self-directed here at Wayne. There is a research elective that you can apply to be a part of. But personally, like in my experience, I just found someone I'm really interested in working with and emailed them and just expressed my interest. And that's how I got involved in research. But being a part of like student orgs and interest groups can also help you find a mentor, and then they have connections and things like that. So I don't know if anyone has a different experience or wanted to add, but.
Yeah, I know we created a research abstract from one of the community partners that we work with for BMA. It was this not reach out to the Rack It Up Detroit, and we kind of brought a clinical skills day to them, and created a pre and post survey analysis. And so, I mean, not just with that, but with other groups or with other things that people may do, you can create a research experience out of it. Most of those groups have a faculty advisor, so they can kind of guide you to see how can we create this into a research project. But additionally, like Maria said, it is a lot on your own too. So it's about kind of connecting with some physicians of a project that you're interested in.
Yeah, thank you, Curtis. And like Maria mentioned, we do have the research elective. I was actually a part of that. And I thought that was really beneficial for like helping connect. So there was a question earlier about like, are there any orgs that like help teach like how to read research papers or talk about upcoming journals and things like that? That was something that we did in the research elective. So that was a really exciting opportunity as well. I think, unfortunately, that is just about all of the time that we have. Hopefully this was helpful for you guys. We will have upcoming events in the upcoming weeks. So if you keep an eye on the admissions page, we have coffee talks and things coming up. But hopefully you guys learned something. We're really excited to share our passion for all of our orgs and our club. And so I know a lot of the panelists put their emails in the chat. I'm sure you can reach out to them. Also, feel free to reach out to MD Admissions with any questions that you might have. And thank you so much for spending your Friday afternoon with us. I hope you guys learned a lot, and we're happy to have you, and hopefully we'll see you around campus in the upcoming year.